Today, ConsenSys Health announced the Stop COVID-19 virtual hackathon, launching April 13 and running until May 11th. The hackathon is co-sponsored by Gitcoin, Hyperledger, ConsenSys, 1 million developers, and OpenMind. More info coming up next. The idea behind the Stop COVID-19 virtual hackathon is to leverage blockchain and other emerging technologies to improve data access, trust, and transparency for researchers, healthcare experts, and life sciences professionals attempting to better understand and stop this and future pandemics. ConsenSys Health has issued a call for hundreds of healthcare and life sciences leaders worldwide to serve as mentors. By leveraging their industry expertise, as well as with technologists across Web 3.0, the goal is to develop innovative new solutions together. Quoting Heather Lee Flannery, who is the founder and chief executive officer of ConsenSys Health, "In the face of the COVID-19 crisis, our goal for this global competition is to bring together healthcare and life sciences domain experts with engineers from 3 open source software communities, Ethereum, Hyperledger, and OpenMind. Working together for the first time with a very specific tool set, this interdisciplinary group will rapidly create highly relevant solutions with the potential to have both immediate and long-term positive impact. The core of our effort is to leverage converging innovations like blockchain, tokenization, zero-knowledge cryptography, and federated machine learning to advance immediate and long-term public health goals while preserving individual privacy." Leveraging the McKinsey model of resolve, resilience, return, reimagination, and reform, the hackathon solutions will be evaluated by each phase of the pandemic that they address. Healthcare and life science expert volunteers serving as mentors will help software developers understand key topic areas in those phases. Some of these areas include clinical trials for treatments and vaccines, global screening data, vulnerable and at-risk populations, identity provenance and consent, privacy-preserving location tracking, and supply chain optimization for ventilators and other vital medical supplies. The Gitcoin platform will host the hackathon through bounties, grants, and hackathons. Gitcoin has facilitated over $4 million of value transfer for open source work within their community of 36,000 developers. On the prize side, the Stop COVID-19 hackathon prize money totals $20,000, $10,000 for first place, $7,000 for second place, and $3,000 for third place. Winning entries will also be fast-tracked for additional funding through Gitcoin, ConsenSys grants, as well as other funding opportunities through ConsenSys Health. For those looking to learn more about blockchain, ConsenSys Academy is offering 2 full weeks of training for free to novice Web 3.0 developers who want to get up to speed quickly to be able to contribute to the hackathon. According to Brian Bellendorf, executive director at Hyperledger, to take on the challenges brought forth by COVID-19, it is vital to marshal experts from across disciplines and markets. This hackathon brings together the medical and scientific communities and elite developers with the singular goal of developing operational solutions built on cutting-edge software to mitigate damage and speed recovery from this pandemic. Hyperledger fully embraces this opportunity to help accelerate innovation on this front and will engage its community and technologies in this incredibly important work. In order to make sure that the solutions generated will meet the complex requirements of the healthcare and life sciences ecosystem, hackathon participants will be able to join virtual panels with mentors from academia, public and private sector healthcare, life sciences organizations to better understand the problem space, as well as identify mentors as the right fit for future endorsements of projects. The confirmed judges for the hackathon include Joe Lubin, founder and CEO of ConsenSys and co-creator of Ethereum, Brian Bellendorf, executive director of Hyperledger, Dr. Alex Kahana, who is the chief medical officer of ConsenSys Health, Dr. Sean Mannion, the chief scientific officer of ConsenSys Health, and Dr. Jonathan Holt, chief medical informatics officer of ConsenSys Health, and Debbie Bucci, Director, Patient-Mediated and Institutional Data Exchange at ConsenSys Health. If you are an expert in the healthcare and life sciences industry with experience in coaching startups or technologists, you can apply to be a mentor on the hackathon's website. If you can help with supplying data, prizes, or leveraging your network to increase participation, you can apply to be a partner as well. For more information or to join the Stop COVID-19 Hackathon as a mentor, partner, or participant, visit consensyshealth.com/COVID-19. Thanks, have a great day, and I'll see you soon.